Right, let's go.
Brilliant. So we know that there's been a lot of reform happening in aged care with the passing of the new Aged Care Act and since the new government came in. And so there's been 9 key changes into the aged care reforms that have been coming in. And you can see out of 148 recommendations, these are some of the key recommendations that they've made quick, swift, I guess, movement towards implementing. And we'll be going through, we're working on a resource document for our participating homes and for when we're engaging with aged care homes to map how we map to all of the possible recommendations. But for today, because we're just doing a quick overview for you, we've pulled out some of the key areas and the key domains where PACOP can really help aged care providers and even palliative care services to help evidence how we're influencing some change and helping homes to implement change to meet the recommendations as well. So we can see here, we're all familiar with the new AN-ACC funding model that's now come in. And so that's key to a recommendation 120. And we map quite closely to the AN-ACC. So we've got a couple of resource documentations, and there's a morning tea talk that we did on how we can fit with the AN-ACC and help homes there. And we specifically have 3 of our standardised assessment tools included in all our assessments. And then
you'll see on the screen.
Example.
Yep.
And so we use the RUG-ADL, the Rockwood Clinical Frailty Scale, and the AKPS. And so we'll be able to assist homes to map and monitor for resident changes to make sure that those assessed needs can be identified and acted on quickly. And so that's one way where we're supporting this recommendation and the new reform into AN-ACC as well.
And of course, with the AN-ACC, it's important to realise, of course, that the AN-ACC assessors will do their own assessments, but they will be using these tools. So if you are using these assessment tools as part of PACOP to routinely screen your residents and monitor, to sort of find palliative care need and changes, then hopefully they should align with the AN-ACC assessments, because they are the same tools. And if they're used correctly, of course, then they are going to match up. And of course, what they're looking for is your care plan and the care you deliver to match your assessment, their assessment. So if your care plan and what you deliver is based on these assessments, it is going to match. Yeah. So that is really quite a reassuring feature of using PACOP, knowing that you're not going to get any surprises, hopefully, when AN-ACC come and do their assessments, because they should really match up because you're using the same tools.
Absolutely. And especially with AN-ACC being the first funding model to assess for palliative care, that's such an important I guess, commitment to palliative care in aged care. And our clinical judgment tools and our resourcing really help develop that in your staff and help map that with some of the key criteria in the AN-ACC for identifying palliative care needs as well.
Yeah. So that is quite a big one. And like Laura said, we've got a talk. You can have a look for more information, or you can chat to us at any time. So we'll move on to some more recommendations that came out of the Royal Aged Care Commission, and we'll talk about how we meet them. So specifically the ones on the screen, we've just grouped them together in numbers because these recommendations all relate to delivery of high quality care in aged care. And of course, they have defined that or clarified that high quality care includes, it's informed by assessment, it's responsive, and it is supportive. So PACOP, meets all of these head on. I mean, our whole program is based on a thorough assessment, routine, regular assessment of residents using proven assessment tools for palliative care need. So, a big feature of PACOP really is that with our profile collection, which is sort of part A of our collection, we start screening on admission. So as soon as a resident enters the home, they are started to be screened at a minimum of every 3 months for palliative care needs and more regularly if required, so that you can identify clinical change and palliative need early and provide appropriate response and supportive care, which meets all of that. So, we could go through our assessment tools and tell you which one meets this, but really it's all of our assessment tools which work together in a suite that really gives that great holistic assessment of resident. And of course, included in that is assessment of the family or family carer. which is important because, as we know, in palliative care, that forms a unit of care, and that also feeds into that recommendation for supportive, high-quality care. And we also have that resident rated tool of the SAS, which is the all-important tool, which really enables care to be given resident-driven care, because they're letting us know through that tool what is important to them.
Yeah, and I was really pleased when we were at this PACOP symposium and Nicole Fitzgerald was talking from the Department of Health. She specifically made mention to programs like PACOP and PECOC as being, I guess, that embedded way to help implement these reforms. And so she specifically mentioned the reform with the 24/7 RN access for aged care homes, and linked that back to the ability to respond and support these decisions through use of things like our response guides as well, Nat. And so where there is an assessment with a response guide, they've then supported aged care homes to follow through with those actions by ensuring they have access to clinicians to react to those needs. So that was a really nice clarification of how we're helping, not necessarily just in palliative care, but on a whole with these changes in the aged care sector as well for staffing and resourcing.
And that will feed into one of the other recommendations we're going to chat about in a couple of slides. But that's a perfect point, because we're not just coming in saying, do these assessments, because an assessment isn't an assessment unless it has a response.
Yeah.
So we all know that, and assessment equals response. So not only do we guide care by the comprehensive assessment, but we also, even in our simplified profile version of PACOP, there is an action plan at the back. So at no time are clinicians ever left to assess and then, okay, what do I do from here? There are prompts all the way through, whether it be the action plan on the profile collection or the assessment and response framework and protocol that comes into place with the outcomes collection, which of course is that for focused palliative care episodes.
Yeah.
Okay, next recommendation, requirement for quality measuring and reporting. Well, surprise, surprise, this one also fits perfectly into PACOP. I mean, sitting behind PACOP, for those that know PECOC, you know that a large component of PECOC is the data that sits behind it, and that is provided back to the services, in a regular 6-monthly cycle, and benchmarks and state reports, national reports, and it drives that ongoing quality improvement. Well, PACOP is going to be running on exactly the same model. So we will be collecting the data from all that assessment that is done on residents, so that is like a great use of that assessment data. I mean, obviously, in the first instance, it's used at point of assessment to drive care and to change care. But then with that information, you can then provide that to us in a 6-monthly cycle. We will package it up in a suite of very usable reports and send it back to each service. And then in time, of course, we will be meeting to set the national benchmarks for PACOP. And I believe that will be happening in the first half of next year. And that is a collaborative process between the participants in PACOP from the actual aged care sector themselves and PACOP. So we meet together and decide what is important to benchmark in the sector, and then we go from there. So if we go to the next slide, we can sort of show you how our 6-monthly reporting cycle works. So starting at the orange box, your resident assessments. Your resident assessments at point of care, you record your assessment scores, you respond, you track your symptoms and problems, you plan and review care based on those assessments, and you keep going with that cycle. But then you enter that data. That data gets entered into a software system locally at each aged care facility or aged care organisation. Every 6 months, that is sent to PACOP in a de-identified form, secure and de-identified form. PACOP will then package it up into a series of reports, send it back to the home to use, as we've already talked about. And then from hopefully mid next year, we will be including the results of each aged care home in your reports against the set benchmarks. Once again, this information will be confidential to the aged care home and will not be shared with anybody else without their permission. But benchmarking in healthcare is a proven way to drive improvement. So, and that is a large part of the PACOP program. And with that, of course, comes quality improvement. Did you want to speak to this one, Laura?
Yeah, absolutely. And so when we do our 6-monthly data reports, The ifs, like Nat and myself, we have a meeting with our participating homes to really make sure that they understand it's not just the data in the report. You know, we're really staunch believers that each data point really tells a story about the resident journey. And that's a value that's held through all of ASRI across our 4 outcome centres. And so we really make sure that the sites understand what's in the report, and you know, Janelle likes to say it's only a problem if you can't explain it. So really, we like to listen and learn from our services and find out what's happening on the ground. And if there's been an improvement made, what did you do differently? You know, how did you improve that number? And so we can use that in our communities of practice to help other sites learn and improve and share together. And where perhaps there is room for improvement, we work with them to problem solve and try new things. And then we can measure that back in the next reporting cycle and demonstrate improvement. And that's really great validation for staff to understand and just to see that figure and say, wow, we completed the X number of assessments, and this is the change in the improvement at a resident level that we've had for their quality of care. It's really great for staff morale. So it provides a really
Laura,
strong body of evidence.
Laura, like we say, you can't improve what you don't know.
Absolutely.
So this is why this data that sits behind the assessments is so important.
Yeah.
Knowledge is power, and if you know what is happening and where your gaps are, you can improve.
Yeah, and I guess too, there's been a bit of apprehension in some of the sites. They're nervous about getting this data back, but it's actually been really interesting. And one of the stories that came out, one of my homes who have been in and out of outbreak, they kind of said to me, oh, Laura, I don't know if our report numbers are going to be as good as last time because we've been just so busy. And I was, you know, that's fine. We'll deal with what we've got. And anything is better than what we were doing 12 months ago before you had PACOP, which was, you know, no standardized assessment data to review. And even though they had less, I guess, quantity of data assessment scores, the outcomes were actually better. So they actually evidenced that they were delivering better care, but they didn't feel that they were because they were so busy. So that was so validating for the staff. And they were then actually to share with, I guess, their organisation and their community of practice what they had been doing throughout those outbreak periods, even though they were short-staffed, even though they had other things going on, to really make an impact at a service level. And so that provided a really strong body of evidence for them as well for their QI reporting. And so they've got their history.
And also for accreditation.
And for accreditation, they've got records from meetings with us, the data reports themselves, and then evidence from the site, from the QI activities they've been doing.
Yeah. So that is tick, 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 tick. You know, it's improvement at ground level, most importantly for residents. Behind that's improvement at organisation level or aged care home level, because you have all this beautiful information given back to you in reports. It's an existing cycle for your continuous quality improvement, which is a huge thing for meeting accreditation. And of course, sitting behind that, we will facilitate communities of practice with other like aged care homes and organisations, of course, entirely voluntary, but we know that this is a hugely beneficial thing for all participants, and it's at a safe place to meet and discuss what works, what doesn't, and how we can improve as a sector. Okay, next recommendation. Comprehensive planning and management on a national scale, including regional and remote. And this recommendation speaks to the fact that there is a need for information about aged care homes nationally, regardless of their setting, whether it's in a city, whether it's regional, whether it's rural, whether it's remote, because without that information, we cannot hope to plan appropriately. And PACOP will, of course, provide this data. So it will provide data on a national level as to what is happening where the gaps are, and help drive filling those gaps from a top level. We're talking about government funded and planning level.
Absolutely. It's so important for these homes who perhaps don't have or aren't aware of what access to initiatives they have in their area. And it's really great for these stakeholders to evidence where there's improvement or where there's a need for palliative care resources and secure funding and things like that for those initiatives to improve and meet those gaps.
Absolutely. Okay, next, we have touched on this, but we will touch on it again because this is a big one. So the recommendation was there needs to be a workforce, an aged care workforce that can deliver quality, safe care. So PACOP really aligns with this, and there are, I'm sure you all are aware of PEPA and LDAC, and PACOP has works collaboratively and has an agreement with PEPA and LDAC, and really we all are different pieces of a whole puzzle to improve the delivery of palliative care in aged care. And a large part of PACOP program is that we educate and train staff in the use of the PACOP program, which includes both how to to assess correctly using our assessment tools in our program, and then also to respond to those assessments with our assessment and response framework. We don't just target the healthcare professionals, because we include the care workers in this, because as part of our outcomes collection, the care workers are included in the collection of SAS scores from the resident. And this has proved so beneficial. And it not only is getting so much more information up to the healthcare professionals who often stretch for time, but the care workers themselves feel empowered to advocate for their residents because they know their residents really well. They're with them every day. So we really fit nicely into this recommendation.
We do. And it's important to note too that we are really committed to the ongoing changes that are coming through reform. And so we know that there's a care worker code of conduct coming out in December. And so all of those things we will adapt and support where we can within our program as well. So there's some really important and exciting things that are coming out of this space.
Yes, absolutely. Yeah. Okay, next one. So this is really the last recommendation that we're going to be talking about. But of course, we're open to questions and we can talk more about any subject. But this one really speaks to aged care sector as a whole and the need for there to be ongoing research and development in the sector. Because, without that research, how can we drive change and how can we improve nationally? Which is the same in all settings, not just healthcare. So there needs to be a commitment to ongoing research and development. And of course, PACOP can really assist with this because we will have a huge source of national data on the profile and outcomes of palliative care needs and care of residents in residential aged care nationally. So, and like we said before, you can't improve what you don't know. So with this national data set that we'll develop from PACOP, it will really give a great basis for identifying areas of research, ongoing research and development. And they specifically mention in the recommendations improving aged care through data research and technology. We have our own software system called PAL Centre, which is free to use and part of our service, and that's a data collection repository. But also we are working with the large providers, software providers in aged care to get the PACOP data items into their software system. So really there's going to be numerous ways that aged care homes can submit the data from their assessments, and we're really working with everyone in that space. And then, of course, a national aged care data asset, and that will come with a collection of data, as PACOP goes along. Just like Peacock has been running for nearly 20 years, they have the biggest longitudinal data set for palliative care outcomes in the world. So we know it works, and we're really excited that PACOP's going to be able to contribute to that space by providing all of this information. And anything else we need to add here, Laura?
I think I just want to say too that long term, this is really important. I mean, if we think even within the last 10 to 15 years in aged care, we know that people are staying home longer with home care packages and with that support in the community. And so we know that that population demographic is really changing when they come into aged care. And often they have really complex and chronic conditions. We know there's a huge proportion of our residents that have dementia diagnosis or cognitive impairments. And so it's going to be really invaluable for us as a big picture to have that information that we're going to be getting through this profile on every resident in all our participating aged care homes nationally. To have that information and be able to use that for aged care research to help make sure that we're developing reforms and programs that are going to provide a real asset to those people is just invaluable in the long term.
Yeah, that's right. And really, this is a voice for the aged care sector to show, well, this is this is where the gaps are. You know, like this data shows that it's not just someone's opinion. You know, you get data, and that's what you can work off, because you know data is invaluable in that type of thing. And to date, there has been, and it's great that the Aged Care Royal Commission has highlighted the fact that there is a need for this. There is a need for data, because without data, you can't appropriately change or advance in your sector. So research and develop.
Yeah,
as it says.
and having it in this standardized format as well, because we know otherwise sometimes it's a bit like silos. This organization's doing one thing and this organization's doing another. So having this standardized data set is really gold. Yeah.
And of course, you know, everything we've talked about this morning is part of the ongoing support that PACOP will give services that participate in PACOP. We can't stress enough that we are not an organisation or a model that's going to fly in, train you and disappear. Part of our whole program is that ongoing relationship with the participating aged care homes to train, to ongoing train, to educate, to bring together in community of practice, to drive quality improvement, to bring together groups for benchmarking, and really as a whole picture, the whole purpose is to improve outcomes for residents and families. And we know to do that, we have to do it on a multifactorial level, and PACOP really hopes that we're going to be addressing this by all the ways we've talked about this morning, and of course all the other things involved in our program. And I think we are finished, Laura, unless there's any questions, but feel free to put some questions in the chat or email us.
Absolutely. You and I could talk all day, Nat.
Yes.
We could talk all day. We would love it if there is any questions. Feel free, as Nat said, use the chat, use the question and answer feature, or you can always, even if you go away and have some questions that you, you know, would like some more information on, that we'll put up our contact details, and you can email us at the PACOP inquiries email, and we'll certainly provide any resources or linkages that we can to support you.
And you know, we look forward to seeing you at our next one in January. So that is on Power Centre. So for those of you who have not yet started with PACOP, it might not be completely relevant to you, but you're very welcome to join. And for those that are participating in PACOP, rest assured that we will actually be working with you one-on-one also to explain how to use Power Centre. Yeah. So, you know, the morning tea talk is going to be great because it's going to give you an overview and give you a bit of an idea, but don't panic, because all the services that are participating will be contacting you and saying, hey, Power Centre's ready. You guys, you know, want to go ahead, and we'll provide you with the training. And really, it's a very easy program. It's a really super easy, user-friendly system. So it's nothing to be concerned about.
Yeah.